Today, Olga came in with complaints of pain in the cervical region and the shoulder joints. She wasn't quite sure how to describe the exact location, but the discomfort was mostly in the upper back, especially around the shoulder blades and neck area. It's clear the pain is concentrated in the cervical-collar zone and extends into the upper thoracic region. When asked about her daily activity, it turned out that Olga is a film director, quite an active one, running around the set all the time. Unlike the stereotype where directors sit in special chairs labeled director, she's constantly moving. This kind of physically active work, especially combined with prior physical strain, can lead to the issues she's experiencing. There were no surgeries, chronic illnesses, or notable past traumas. However, she recalled an incident from her student days when she pulled a muscle in her back. The pain was severe, so she went to a doctor who initially suspected a herniated disc. They took X-rays, which revealed no major issues. Most likely the issue at that time was visible to an orthopedist or neurologist, given the imaging done was probably a radiograph, not MRI. Olga also mentioned that she had a background in dancing. She used to dance a lot, and during one of her workouts, specifically while doing squats with a barbell, she lost balance after something made her laugh, and she just dropped into the squat, which likely triggered the old back pain. It's important to note that spinal issues are most commonly aggravated during fitness sessions, especially with improper technique in exercises like deadlifts or leg presses. These activities often lead people straight to neurologists or neurosurgeons. That's why I always advise avoiding heavy lifting. Lighter weights with higher repetitions are more effective and much safer. It's equally important to stretch the muscles right after strengthening them to prevent shortening. In Olga's case, the injury was a one-time event. Since then, she's shifted her workouts to include mostly cardio and flexibility-based routines like yoga. At 28, she's starting to feel the early signs of wear, which is common as people approach 30. For cardio, I recommended using the elliptical machine in reverse motion, which engages different muscle groups and burns significantly more calories. Stair climbing, while good for many, can worsen symptoms if there are existing spinal issues, such as herniated discs. In such cases, the elliptical or a stationary bike is preferable. She mentioned occasional discomfort while running. The general rule is, if an exercise causes pain, it needs to be removed or modified. The same muscle groups can be trained through safer alternatives that don't overload the spine. Pain is an indication that something isn't right. After gathering all this information, we proceeded with the physical examination. While standing, we checked her posture and muscular symmetry under axial load. Her rhomboid muscles were weak and required strengthening. A slight asymmetry was observed, suggesting possible vertebral rotation, although this couldn't be confirmed without deeper imaging. We then moved to the treatment couch. Palpation revealed tension in the paravertebral muscles and quadratus lumborum, with trigger points indicating tight fascia. She reported pain upon pressure in some areas, especially when pressed harder. Though, contrary to popular belief, deep pressure isn't always necessary or beneficial. We proceeded with a warming massage to prepare the tissues for manual therapy. The massage went well and was effective. We then began stretching techniques. She responded well, didn't resist, and followed all instructions. During decompression, she felt some cracking and mild discomfort, which is common if the body isn't fully relaxed. I reminded her again of the importance of staying relaxed to reduce pain. At one point, she even mentioned feeling a bit nauseous, which can happen when tension is high and the body resists movement. We joked a bit to lighten the mood, which helps since laughter, as we know, prolongs life. After a few adjustments, the discomfort decreased significantly. We continued with further adjustments, including stretching the lateral muscles, thoracic mobilization, and a decompression sequence. Olga noted that she felt some pulling and even a brief headache post-adjustment. This sometimes happens due to the body's reaction to new movement patterns. That's why I always caution patients not to make sudden movements immediately after manipulation. We finished the session with supine movements and stabilizing techniques. Olga tried a few head turns while lying down, and we removed her headband to make her more comfortable. A light, supported stretch helped relieve the remaining tension. She reported feeling significantly better, lighter, more relaxed, and able to breathe more freely. We also went over the exercises she needs to do at home, with an emphasis on technique and consistency. There's nothing overly complex, just proper form and regular practice. In the end, she felt grateful and encouraged others to book a session, joking that I could drive out all their inner demons. She's now all set and well aligned. We wrapped up the session by thanking our viewers for watching and reminding them that more content is coming soon.